So doctors have used body weight and body mass index as a metric for heart health for a long time, but a new study out this month reveals weight or BMI may not be the best way to predict heart health. Medical expert Dr. Kevin Campbell joins us again today with more. All right, explain what this means.
So we have traditionally really followed weight. We've followed body mass index, which is a ratio of weight to height, to determine if you're obese or not. And this new study really helps us determine what your body shape is, meaning where do you carry that weight? It actually may be more predictive of who's at risk for heart disease than not.
So like the apple and the pear, that's a real thing, right?
Exactly. An apple-shaped person carries everything around the middle. And when you have all this body fat on the middle, the study that we released at the American College of Cardiology showed that you had a higher risk of heart disease. If you're a pear-shaped, you kind of carry it more in your rear end and on your hips, and they had lower risk. Still, obesity is a big problem in the U.S. today.
So what do you do?
The first thing you do is you move, you exercise. Obesity and obesity-related illness cost us $150 billion last year in the U.S. alone. So, you know, I tell my patients, how do your clothes fit? How do you feel? That's a better metric than focusing on weight, while weight's important. And then, you know, this body shape thing can really help us as physicians identify people at higher risk.
You know, I have noticed that people that are now wearing, you know, the band that will determine how many steps you take and what your heart rate is, they're really setting a goal every day. These are folks who usually wouldn't exercise. Now they're out trying to get 10,000, 12,000 steps a day. It's a motivator.
And that's so important. You know, I always talk about engaging patients and engaging together as doctor and patient to make ourselves more healthy. And when you have something like a wristwatch or a band or a Fitbit that can count your steps,
sure,
it gives you something to work for every single day. And then you can go up and work for higher goals after you just get your 10,000 steps.
You don't have to go to the gym to do it, right?
You absolutely don't. Just walk around the block, walk around the neighborhood, enjoy this beautiful weather that Alyssa brought us today, and go from there.
Take the steps when they're an option. That's another thing, too. Thanks for joining us, Dr. Campbell.
Thanks so much.
Now, if you want to learn more about organ donation or about Aljay's journey that we told you last week, just go to our website at WNCN.com. And if you have any questions, you can put them there as well.
Get moving. All right.